it's important to differentiate spirituality versus religion. And I think this doctor did a good job here of summing it up. The spiritual is that realm of the human experience, which religion attempts to connect us through dogma and practice. And sometimes it succeeds and sometimes it fails. Religion is a bridge to the spirituality, but spiritual lies beyond religion. Unfortunately, in seeking the spiritual, we may become attached to the bridge rather than crossing over it. And I think Rumi's quote, "I belong to no religion. My religion is love. My heart is my temple." So I often wonder how psychotherapy might be improved if it focused more on enhancing positive emotions rather than focusing on the negative emotions. Remember that the entrance door to the sanctuary is inside of you. And a lot of research on what is spirituality. And there's a constellation of 8 positive emotions that have come up: awe, love, trust, compassion, gratitude, forgiveness, joy, and hope. So I think if you're like me and most people, we'd all love to have all of those emotions all the time. And you don't need to travel anywhere. Journey within yourself, enter a mind of rubies, and bathe in the splendor of your own light. Spirituality is our deepest sense of belonging and connection. It's a deep connection with ourself, with others, with nature, and a larger sense of wisdom and love. It's about a sense of purpose, meaning in life, positive emotion, and it's a range of ordinary and mystical experiences of oneness. So we're all connected. We're not these individual beings. We're all connected. And it's really getting the ego to shut up and reveal the inner core of peace. For me, spiritual is a good name for some of the powerful mental phenomena that arise when the voice of the ego is muted or silenced. There is much more to consciousness than the ego, as we would see if we would just shut up. But the ego, that inner neurotic who insists on running the mental show, is wily and doesn't relinquish its power without a struggle. And that's a quote from Michael Pollan. So let's talk a little bit about the inner light and the ego. So I really like the light in the lampshade model. So if you imagine that the light bulb is you, it's your core self, it's your spirit, it's your true self. And then the lampshade is basically your ego. And it's going to filter perception, it's going to color emotion, it's going to help determine your behavior. And it basically, you can see in this, is isolates the core self from the larger whole. So we're all walking around with these like lampshades on our lights that are kind of filtering us from other people. And you can have a lampshade that's clear and translucent, like the one in the middle here. You could have a really thick one. So trauma wires the nervous system to protect rather than connect. So if we had a traumatic childhood, we're going to more likely have a big, thick lampshade, and that is going to cause distorted perception through an identity that seeks safety and love, but can't seem to find it. And it causes consistent suffering. Psychedelics can be a way to kind of like loosen up that lampshade or make that lampshade more translucent so that your light shines. And so you can see things clearly. If you've got a dark lampshade around, you can't see things clearly. The default mode network, it's basically like what our mind is running on when it's not doing something else. So it's the resting state network. If right now my default mode network probably is not doing a ton because I'm actively presenting. But if I'm just sitting here and I'm not doing anything, that's kind of where my brain goes. It's the core of who you are, and it's kind of the default center of gravity. And the important thing about the default mode network to know is what our default mode network is going to depend on what our childhood was like. So the ACEs are adverse childhood experiences. Every patient that comes to see us fills out an ACEs score. And that's so we can see like what's happening basically with your default mode network. If your ACEs score is high, you can see here, if you have 4 more ACEs, 14 times the number of suicide attempts, 4.5 times more likely to develop depression, 10 or 11 times the level of IV drug use, 3 times the level of lung disease and smoking, 2 times the level of liver disease. As we study these adverse childhood experiences more and more, we learn more and more that the impact that they have on us. People with 6+ ACEs can die 20 years earlier than those who have none. So it's really a big deal. Childhood trauma disrupts optimal brain wiring. So, and that's because it's back to that ACEs. So from the time really that we start gestating until 11 years, that's kind of the most important time that our default mode network is forming and our constructs of how we see the world. And so if we have a traumatic childhood, our brain wiring is going to get all messed up, and that's going to rule the rest of our life. That's one of the things that psychedelics really at the core are doing, is they're helping to restructure that default mode network so that when we're in a resting state, we go to a good place and not a bad place. So what were your experiences growing up? Were you in a dark swamp with swamp monsters, or was your life like rainbows and unicorns? And if you were in a dark swamp with swamp monsters, that's what your default mode network is going to be like. And if you had lots of rainbows and unicorns, that's what it's going to be like. And we have 3 different main networks in our brain. The central executive network is what I'm using right now to present. The salience network can kind of go between survival or self-care. And the default mode network is kind of like what we're doing when we're not doing anything else. So we kind of want our default mode network to go to a nice place. And because of the fact that childhood trauma is going to disrupt optimal brain wiring, we're going to have this inner critic that's going to tell us that we're unworthy, we're unlovable. We're going to see the glass not only as half empty, but it might be filled with maggots. And the pain and injustice and helplessness keep that default mode network in overdrive. So not only is it sending suboptimal things, it's also in overdrive. So it's telling us all the time we're unworthy, we're unlovable, over and over again. It makes us hypervigilant, hyper-aroused, and hyper-ruminating, even at rest. So we could be sitting there on a beach and everything's fine, and we're still going to be feeling all that. So someone taps us and we jump. When we have this disrupted wiring, it's going to cause sleep disorders, because messed up neurocircuitry is going to mess up the HPA axis, which is our stress center, the hypothalamic pituitary adrenal axis. And then psychologic pain is stored in the default mode network as well. So it's just going to make everything harder. The nice thing is, if we have a healthy default mode network, that's going to be related to decreased anxiety, decreased depression, increased tolerance, increased memory, increased self-awareness, and increased goal setting. Take the pearl and leave the shell behind. So the pearl is our light, our true self, and the shell is the lampshade. The present moment is the only aperture through which the soul can pass out of time into eternity, through which grace can pass out of eternity into time, into the soul, and through which love can pass from one soul time into another soul time. I've been a seeker, and I still am, but I stopped asking the books and the stars. I started listening to the teaching of my soul. All right, let's talk about a 35,000-foot view of disease versus health. So basically, we talk about this a lot with our patients and with our team. Whether we're in a state of disease or health really just depends on if our biologic systems are stronger than all the internal and external stressors. So the biologic systems are everything you can imagine: your immune system, digestion, detox, hormones, and then the stressors are anything external and internal that causes stress to your system. If we have too many internal and external stressors and they outweigh the biologic systems, then we're in a state of disease. If it's the other way, then we're in a state of health. Another thing to talk about with integrative medicine is we look at everything holistically. So we really believe that everything in the body is connected, versus when I worked in conventional medicine for many years, we looked at things by part. So if you had something going on with your throat, you would go to an ear, nose, and throat doctor. If you had something going on with your gut, you would go to a GI doctor. If you had something going on with your bones, you would go to an orthopedic doctor. And the way we look at things is everything is connected. And for sure, as we talk about spirituality and psychedelics today, that's the reason that they are both so important is they affect the entire organism. So if you imagine a bathtub, and if you imagine the container is basically our biologic system capacity, and then the water going in is all of our internal and external stressors that are coming in all the time. And then the drain is basically our ability to get rid of those stressors. And let's talk specifically about why it's better to be in parasympathetic most of the time. So let's think about our autonomic nervous system here for a minute. So we've got our parasympathetic nervous system on one side and our sympathetic on the other side. And this is just a diagram showing for a bunch of different systems in the body, how the parasympathetic and how the sympathetic actually control what's going to happen in our body. So a couple things that I'm sure all of you have noticed is if you're nervous, your mouth is going to get dry. And that's because literally the nerves in your sympathetic nervous system are actually inhibiting salivation. The opposite, if you're in the rest and digest parasympathetic, you're about to eat, you're going to salivate. So that's one reason why, like, we don't want to be eating, for example, when we're in sympathetic, because we're not producing all those initial enzymes in our mouth. That's just a very small example. And our sympathetic nervous system has served us really well. We're all alive now because our ancestors were really good at outrunning saber-toothed tigers. And that's great. That's why we're alive now. And we can thank our sympathetic nervous system for doing its job. And we need our sympathetic nervous system. But what's happened, particularly over the past couple of years with COVID, is that most of us live in flight fight most of the time. And that's really a really hard place to heal and feel well. If you think about, how would you like to feel? Would you like to feel like the person on the right here who's running away from something, or the person on the left who's hanging out in the hammock? So most of the time we want to be more relaxed in our bodies and not running away. Certainly, if you're in a situation where you need to run away, you want your sympathetic nervous system to work, but you also don't want to tire it out by using it all the time. Parasympathetic is kind of the rest and digest, like the puppy resting there, and then sympathetic is the flight and fight. The more that we're in parasympathetic, the more our body is going to be able to heal, and the more our body is going to be able to produce the hormones that it needs, the more it's going to be able to digest food and get our nutrients in. So that's where health lies, is being in parasympathetic as much as possible. So when we're in sympathetic, we feel anxious, our blood pressure is high, we feel tired, we feel depressed, we feel irritable, our muscles feel tight. When we do things to calm down our nervous system, we feel way better. So sympathetic, our pupils are going to be big, our heart's beating really fast, our lungs are going to increase oxygen intake so that we can run away. Our stomach is going to contract so we can't digest food. So again, we need the sympathetic, and it's helpful, of course, but we want to be in parasympathetic more of the time. So you can look down to, for example, bladder, and you can see that the sympathetic nervous system is actually going to stimulate the bladder. So if you feel like you're peeing all the time, that could actually be your sympathetic nervous system that's contributing there. So think about your computer. You're watching this on a computer or a phone, most likely. When you get that spinning rainbow of death kind of in the picture there, and everything just kind of shuts down. You can't do anything. What's your go-to to get your computer working again? It's to reboot it. When you reboot it, then what happens is you get the computer opening up without all the unnecessary apps, and things work a lot better. So the same kind of idea happens with the stellate ganglion block. When we're stuck in flight fight all the time, we're thinking about the future, we're thinking about the past. It's really hard for us to be present in the moment. When we do a stellate ganglion block, it's like a reboot on that. So it takes away all those concerns of the past and the future, and then we can be more present, and it just feels like you're more focused. It takes away all that extra distracting noise, so to speak. And similar to the computer, if you reboot your computer and then you open up a bunch of apps after, your computer's going to slow down again. So what we do in the office with everything that we're doing is probably only 10% of long-term change. So we do a stellate ganglion block, and it's kind of like rebooting your computer. And then if you open the apps up again in your life, so if you go back to doing all the same stressful things again, it's not going to work as well. So we always like to support people with behavioral changes that are effectively the same as like not opening the apps again. So what can happen, so maybe you have a disrupted microbiome that's keeping your bathtub half full already. And then we add in some chronic stress. So it's almost full, but you're still doing okay. It hasn't overflowed. And then you add COVID in, and suddenly the bathtub overflows and you have all these symptoms. So the way we look at things is, how can we make the bathtub bigger? How can we open the drain? And how can we turn down the water, which is the internal and external stressors coming in? It's really that simple. And I want everyone to understand that your body is super smart. Your body is way smarter than my mind. And so all we're trying to do really is help to give your body and your mind what it needs to be in balance, and help take away what it doesn't. And then magic happens, and the body gets in balance, and you feel good, and you can go back to doing everything that you love.
I believe that creativity is a health factor. I think that if we don't be creative and allow the creative flow to go through us and out into the world as evidence, that could be performance, it could be music, it could be dance, it could be gardening's evidence, cooking, whatever it is. If you have creativity flowing through you, it's a health factor. It will help your health. If you don't, if you block it, if you say, I don't have time, I'm too busy typing on my computer and, doing things for other people and not really focusing on my creative life, your physical health could suffer from that because you're blocking the creative flow.
Yeah.
I mean, you're not allowing yourself to be the identity that you see yourself as being. So I do think that, yes, creativity, and it may not be art. And it may be like you want to play the flute, I mean, look at the flute. I'm serious. It's a very simple instrument. I picked up the piano at the age of 62 after a 50-year hiatus. So
any creative outlet, really. Could be parkour.
Parkour. Don't forget to do it, whether you do it professionally or not. I always say, you don't have to be Lance Armstrong to enjoy riding a bike. You can ride a bike for fun, and so can you make art for fun and for spiritual enrichment. Gives you such great joy.
Avoiding stagnation, because all stagnation leads to pain and pathology. So all of these internal movement arts, there's such a focus on opening. So opening up the mind, body, and spirit.
I want to always address the microbiome, because if you've been in stress, flight, fight, sympathetic for a long time, that has almost 100% affected your microbiome. So if we just address the brain and we don't address the microbiome at the same time, the microbiome is going to send messages back up to the brain, which is going to cause the brain to be inflamed again and cause you to kind of slip back into those symptoms. And so it's kind of back to the rebooting the computer. We want to also, in addition to minimizing the stressful things that we do and balancing out our nervous system by doing things like meditation, yoga, things like that, we also want to address the gut at the same time. So important that we always think of both of them together. Conversely, if someone comes in and has a bunch of gut problems and we don't address the brain is going to send messages back down to the gut. So we get people that come in that, for example, have had head injuries, and that's causing gut problems. We get people that come in that got food poisoning, that's causing brain problems. So we always want to address both of them. So you might decide that you want to come in to get a stellate block and a vagus block, and pretty much we always block the vagus nerve at the same time. So it's a reboot of your complete autonomic nervous system. The sympathetic and parasympathetic nervous system affects everything in our body. So the more that we can get our bodies in parasympathetic, the more that we're going to allow ourselves to heal. Ketamine is another treatment that we provide, and ketamine stimulates nerve growth. It stimulates the growth of both the parasympathetic and sympathetic nerves. And because the stellate block is kind of helping to chill out the sympathetic nerves and helping to improve our parasympathetic nerve growth, in theory, the combination of stellates and ketamine really have the potential to stimulate parasympathetic nerve growth. And it does really seem that people that are doing them synergistically get better results than one versus the other alone. So psychedelics have really gotten supercharged over the last few years with Michael Pollan's book, How to Change Your Mind, and then his Netflix series. We've gotten a lot of folks coming into the office asking about ketamine drips and ketamine treatments after reading the book. So ketamine specifically has been shown to help the default mode network in the right doses. And it's a synthetic derivative of PCP, and it's been used for years as an anesthetic in the hospitals. It can be taken oral, it can be taken snorted, it can be used IV, IM. It's currently FDA off-label for treatment of treatment-resistant depression and pain as well. But I think it's probably, with most of these psychedelics, it would be beneficial for almost anyone to just kind of help basically remove that lampshade and just help you to be your true self. However, in terms of like what's legal, what is hopefully going to be covered by insurance more and more, is for treatment-resistant depression and pain. People usually feel pretty good right after the drip, and it can last several days to weeks. The reason we want to do more drips is to make it last long term. It helps to modulate dopamine, serotonin, and norepinephrine. So those are all neurotransmitters that make us feel good. And then they also bind to our opioid receptors, which is why we have a decrease in pain with ketamine. This is just a little diagram that I'd like to show briefly, just to show how IV versus IM ketamine works. So when we do an injection into your muscle of ketamine, you're going to get this huge spike, and then it's going to come down. Versus IV, it's kind of nice and even. We can also do oral as well, which is going to also be more even, but that kind of depends on your absorption. So in the office, we usually do IV. Obviously, we can't really do IV in a group ceremonial setting, so we use oral for that. And what's it going to feel like? For most people, I would say their first experience with ketamine is kind of like an open mind, open heart, rainbows and unicorns. It's usually pretty nice.